Welcome to TB MEDSIS How-To, Binational Transfer. Looking at you when your patient is moving out of the United States. The good news is that we have partner organizations that can help facilitate transfer of care from the U.S. to other countries. The other good news is that partner organizations also have access to MEDSIS, which helps facilitate communication. In the next couple of minutes, I'm going to run through how we can use MEDSIS in a CureTB referral. As a reminder, MEDSIS is a homegrown Arizona surveillance system. CureTB is not part of MEDSIS, but rather a jurisdiction similar to local health departments within the system. As such, we can share cases in MEDSIS with them after patients are referred through their normal processes. So, how do you get to their normal processes? Well, all you need to do is go to the website. So here's the website right there, and that will take you to this page. And on this page, you can see that they have their services summarized as well as the forms over here. So if we go to their services to see what they can assist with, you can see that they can assist with transfer of active, so anybody who is verified or probable TB cases to all countries. Currently, for clinical history requests, it's just for Mexico and Central America, contact notification, Mexico, source case finding, Mexico. So how do the steps work? This is basically the flow of it. And the important thing is really starting that referral process early. So as soon as you realize that you have a patient that might go to another country, you can start the CureTB referral process. And they have some different tips down here too. So how about the form? We can see the different types of forms for each type of service. That will take you to this page here. And like any online form, I recommend downloading it and saving it on your computer. That way you don't accidentally fill everything out and lose all the work that you do. So I'll go ahead and you would save it here. Save it to your desktop. I'm going to close that out so I don't accidentally fill out the wrong form. And then I'm going to go to the CureTB form. And this is where you can go ahead and you can fill out whatever you need to. Go ahead and make it bigger. And it's really important to have contact information in the destination country. They will be doing an interview with the patient prior to them leaving the United States, so they'll be able to get the information if you're not able to get it yourself. Hopefully they can get it. If they can't get it, then it'll probably be a failed referral, but they'll do their best. Underneath the comment section, that's where you can get the MEDSIS ID. And that's the first step in how we can integrate MEDSIS with the normal referral process. And now I'm going to show you an example in MEDSIS, how we would, after the referral is done, be able to document the information in MEDSIS and use MEDSIS as a communication tool with CureTB. So we're going to pretend like this gentleman here is from Mexico. You can see that he already has his address there. Hopefully you'd have more information than just that, and hopefully you'd have a phone number too. It's really helpful if you have at least 2 different contact people in the country that they're going to, so that CureTB can help to track them down. It's also helpful if you're able to establish a rapport with the patient prior to them moving. That way the patient will have their phone number and they can always reach out to CureTB if they happen to go someplace else. So we'll go ahead and go into this patient. You can tell this is a training site. And we are going to go down, and the first thing we're going to do is that we're going to make sure this is actually shared with CureTB. Because if you put the MEDSIS ID on the referral form that's not shared with them, they can't view anything. So the way that you're going to do that is you're going to go to jurisdiction. You're going to click share. Okay, we're going to go ahead and share it with CureTB. The CureTB is right there. Click share. You hit OK. And now, with this ID right there, they will be able to find this patient, and any attachments that are there, that are any notes that are in there, they will also be able to view. They will not be able to edit, however. And then you're going to also put the attachment that you've already faxed to them or secure email to them in their normal referral process. And this is just a way, to keep documentation there and to make sure that we're all kind of on the same page. So what you would do is you would go ahead and go to New Attachment, and then you would drag and drop the form that was saved on your desktop to this. Okay, I can see that I've attached it. Just put a comment underneath it if you need to. And there it is. You can also put a note there if it is helpful. Just think of MEDSIS as a communication tool. If you haven't already done so, you would also want to update whether or not they're binational. So in this case, Dumbledore is going to Mexico. So you would go ahead and click Mexico as binational. Now, if you're going to Guatemala, you would hit no. You can put in the comment section or in the notes section about him going to Guatemala. So let's go ahead and say hit save. And what that is going to do is it's going to notify the Office of Border Health, and they're going to look at the address that you have put in MEDSIS to see whether or not our partners in Sonora need to know about this individual. And so they would get a notification that it's binational with Mexico. They would review it, look at the address, and they may determine that Sonora needs to know about it, and in that case, they would also be shared with Sonora. What that means is that CureTB, Sonora, ADHS, and yourself all can see the attachments, all the labs, and all the reports that happen. So it's really just a communication tool. So once the patient moves, go ahead and notify Arizona Department of Health Services. You can do this by email using the MEDSIS ID. You can use secure messaging, or you can give us a phone call. If the reporting's up to date, you can then transfer this case to CureTB. That allows CureTB to be able to add notes or attachments. When they can see it only when it's shared with them, they can see it, but they can't make any updates. Any follow-up information that ADHS receives will be added to the MEDSIS case as well. We have routine contact with CureTB, and sometimes they'll let us know where patients are in their treatment, and I would make a note right there, or if I have any attachments, I would add that attachment as well. That's it for binational referrals. If you have any questions, contact ADHS's TV program. Thanks for watching.